Hoad joins me now, CEO of the Medical Laboratory Professionals Association of Ontario. Michelle, great to have you back on the program.
Hi. How are you, Angie?
I'm good. Let's start our, we've talked about so many issues regarding this pandemic. Let's sort of start on the good news front. And of course, vaccinations. We're seeing there New Brunswick now being the 10th and final province to start their inoculations. Of course, we are waiting still, of course, for the Northwest Territories, Yukon, Nunavut as well. But your thoughts in terms of where we are at now to say 2 months ago when you and I were talking?
I think it's actually fantastic news that we have additional provinces coming on and providing this vaccination. It's just more tools in our toolkit to help us alleviate the pressure coming into our laboratories right now.
Yeah, exactly. Now, of course, we're waiting on the Moderna vaccine as well, which could then help alleviate even more pressure and provide more accessibility to those remote communities, Michelle.
Absolutely, it will. I think the one thing that we as Canadians need to remember is that our healthcare system has very strict protocols. So if these vaccinations are being approved, and it looks like the Moderna one will be the next one, we need to stay, rest assured that it is something that will work, and we should all be looking at that.
Let's talk about the work that you and your team do. Of course, the medical testing labs there, thousands of tests coming in. When we look at caseloads, Ontario and Quebec, and we've had the conversation before, they were quite high at the time. They're astronomically high now. But we're also seeing the number of testing, the amount of testing, I should say, increasing. Ontario alone completing 67,000 tests today, 68,000 yesterday. Talk to me about the criticalness of testing, why we need to be doing so much testing.
So testing has been growing exponentially across the country. We definitely can see that in Ontario. The numbers have grown. This has also been directly because the directives in Ontario have slightly changed. So if you are in a healthcare facility or if you're in a long-term care home, if anybody tests positive, they need to test the entire staff and everybody that resides in those locations. So if we think what that means that's a test that's done every 5 days, and it needs to be done 3 times within a 15-day period. That's a lot of additional tests going into our labs. So we should take a moment and applaud our lab professionals across the country because they are working above and beyond right now to hit these rolling targets that keep growing and growing every day.
Exactly. And the results of the tests are also, the more we're doing, of course, the more of a better, clear picture of what we're getting in terms of where the virus is spreading, or at least how much of it's spread within the respective regions across the country.
Absolutely. Testing is an essential part of this entire process. So we need to make sure we are following those protocols to make sure that there are tests that go into the lab that absolutely need to go into those labs, not tests that, I live in the city of Hamilton, and we are going into lockdown on Monday, and I can share with you personally, there is a lineup of cars going in and out of our malls, and It just is astonishing to understand. From a lab perspective, I look at that and I'm like, that potentially could be thousands of more people that need to get tested, and that will affect thousands of people that get up every day and go into our labs, leave their families to do testing that maybe doesn't need to be done, because if we could just follow the rules, then we can do testing that is important to get tested.
Before I let you go, your thoughts on the rapid tests. How important are they in terms of the speed of it and the accuracy?
So from a lab perspective, it's very, very difficult because we are very accurate in the lab. It's either you test positive or you are negative. One of the challenges that we're having with these rapid tests is the error rates are very high. So you need to carry a high viral load. So you potentially could have a rapid test, get off the plane. Potentially you don't have a lot of the virus in you, but you're actually positive and you test negative, and now you can start to infect people. So I think as a tool, it's additional data. It's like the vaccination. It's another tool to help us. I think the rapid test is data that can help us if there's an outbreak, what's happening. But from a black and white perspective, accuracy, reliability, from a lab perspective, they're not the most popular with us right now.
Okay, and of course, again, as you mentioned there, what's happening in Hamilton, what we're seeing in other parts of the country as well. In the end, it comes down to what our hospitals are having to then deal with.
Absolutely. We just ran a survey this week, and some of the results we're getting back are astonishing. 83% of our people working in healthcare are burned out.
Yeah.
They are talking about family. Their families are divided. They don't spend time with their kids. They're working shifts and having to work overtime. I think, I can speak directly to the lab, but this is all healthcare workers right now that are going above and beyond. And we need to just stop and think about our actions and who exactly it would have implications with.
Yeah, certainly. I mean, again, all the incredible work that they're doing each and every day, your team is doing. We certainly commend you all for that. Michelle Hoad, CEO of the Medical Laboratory Professionals Association of Ontario. Michelle, thank you. You stay safe.
You too. Have a good day.
You as well. Well, with those surging